Nursing is a long-standing and respected profession, combining compassion with knowledge, skill, and dedication. Nurses are with us throughout our lives, when we're sick, injured, and in need of support. The field of nursing is very diverse, with many occupations and specialties. Many work directly in their communities, providing resources and ensuring the best care for its residents. Nursing, as we know it today, developed in the mid-1800s. A woman named Florence Nightingale is often regarded as the first nurse. At the time, caring for the sick was not a job for respectable women and was typically reserved for family and close friends. Nightingale felt that proper education and understanding of medicine could drastically improve patient care. When the Crimean War began in 1854, Nightingale and a group of nurses were sent to tend to the injured soldiers who were dying more often from infection than in battle. Nightingale and her nurses established a system of patient observation and cleanliness that brought the death rate of soldiers from 40% to just 2%. Her work not only saved lives, but helped establish many of the standards and practices used in hospitals today. Now, nursing goes far beyond a patient's bedside. So, what exactly do nurses do? There's a wide variety of occupations and specialties in the field. No matter the field and specialty, all nursing takes the same drive, skill, and dedication to care. So today we'll be having a candid conversation about the realities of everyday life as a nurse. And with us today is Magee. She started out as a licensed practical nurse, then she went back to school to become an RN, after which she worked as an ER nurse, and she's now an infection preventionist with CDC's Project First Line. So, thank you for being with us today, Magee.
Thank you for having me.
Awesome. First things first, I'm going to ask you, of course, why nursing? What made you go into it?
So I was working at Movie Gallery and leaving my husband at the same time, raising 2 kids, like small children. I needed something that was flexible and made money so I can do it by myself. And nursing was 100% available for me. It was a very quick program. I went to a local program, the Wilkes-Barre Career Technical Center. And then when I went back for my RN, I actually came here and graduated here in 2018.
Okay, awesome. So after graduation, what was the hiring process like?
You walk in, literally.
That's it?
For nursing, you just walk in.
No application, no like searching around? Just...
No, you just pick a facility and walk in. And it still pretty much is the same.
Yeah.
Nursing is a shortage. And I don't know if it's a shortage because there is a lack of nurses, but more of a lack of a community culture inside of the facilities.
What do you mean by community culture? Like,
so I, as an LPN, it's called licensed practical nurse, but you know, let's play nurse is what everybody used to call it. And basically, it was never looked upon as like a valid nursing practice. And it's great. It really is. I would have some of the best LPNs treat me before I have some of the best RNs treat me, only because they actually care and know what they're doing. But when you walk into facilities, there are people who think they're better than you. And there are people who are just like, well, you just wipe butts for a living. And it's so much more than that. I went into skilled nursing, which is geriatrics. That's the only thing that you're going to get as an LPN that makes $20-something an hour back then, and now it's, me saying back then, I'm like, I've been a nurse for a long time.
Yeah.
Now LPNs get anywhere between 30 and 32 an hour, and they're doing a lot of work. They have 25 patients by themselves. They have to do the wounds, they have to do the charting, they have to do the medications, they have to call the doctors. So they have a lot of things that they have to do, and the people above them usually treat them like crap, and the people below them usually don't respect them. Mm-hmm. So it's really a very hard place to be. One of the reasons I went back to be an RN is because I don't want to be treated like that, and I want to make an effective change, even if it's the one building that I work in. You know, so you have to change the culture of nursing in order for it to be a better nursing.
Mm-hmm. So along with that, was there anything, because you've had obviously different levels, but at each one, what was the most like unexpected occurrence, like you thought it would be different, it didn't work out the way you pictured it?
Unexpected occurrence. Well, I dropped my first patient when I was in when I was in school, in LPN school. I dropped a patient, rolled that patient right off. Glad I'm short because they didn't go far. But I didn't learn how to be a CNA.
Oh, okay.
Because they pulled that opportunity from me.
Explain what the CNA is.
CNA is a certified nursing assistant. They are the backbone of healthcare. They're the ones who help get the patients dressed, who cleans them after they use the bathroom.
Right.
They're the ones that if the nurse wants to know something about the patient, they go to the CNA because the CNA is the one taking care of them. The nurse knows the medical portion of it, but the CNA knows the heart of it. So CNA is definitely the heart of all of nursing. And I will stand on that soapbox until I retire, if I retire. But truly, I never had the chance to learn how to be a CNA. So the first time I ever was working on a unit, and they were like, we need you to not push a cart and do meds. Can you come and be a CNA? I said, yes.
Okay.
And I was like, but I need help. I don't know what I'm doing.
Yeah.
And I think I was humbled more as a nurse than I've ever been as just anywhere else that I've worked. I never thought I would be attached to patients, and you just get attached to them. Sometimes they're just too cute and you can't like help it. And then sometimes they're just snotty and like agitated and you like it. Because you're like, I don't know what happened in your life, but buddy, tell me what's going on. You know, so like for me, nursing was always literally different every day.
Yeah.
Every single day, still to this day. I work with infectious disease doctors, and I've gone and spoke at international infectious disease summits, and I've done all these things, and I'm like, I'm learning something every day, and now I'm doing a different role. I'm putting leadership under my belt, and I'm like, I don't know if I could do it, but I'm going to try.
Yeah, that's awesome.
I'm going to try.
In terms of when you were starting, stuff like schedule and salary, was anything unexpected?
No. Brand new nurses just coming in, you will never get day shift.
No? Okay.
You're never going to get day shift. And if you do, it's because they're desperate and there's something wrong. Worry about that.
Okay.
But you're not going to get day shift. And you shouldn't want just day shift. Like, you want to learn all the shifts. So my first job was actually down the road at Birchwood, and I was overnight. And I had young children. So I was like, okay, they're okay. My mom has them overnight. They can be in daycare during the day while I sleep, and then I could spend the evenings with them, and I was able to afford life with the kids.
Yeah.
So I wasn't shocked at the scheduling. I knew I wasn't gonna, low man totem pole, you're not gonna get it. I was shocked at how much money I made.
Really?
Because I was like, oh, I could do this by myself. Like, I don't need child support. Like, I don't need him for anything. I can do this alone. So I was shocked at that. And then as you put the more work, because I teach my kids this every day, you need to put the work in to make the return on that investment. You need to put that hustle, that grind, that you got to work 2 to 3 jobs at a time while you go to school to make sure that you're home with the kids and doing everything that you need to do to make that investment where you can now work Monday through Friday and make 6 figures and be like, I'm still in school for my master's, and it takes time. I'm older. I'm 44. It takes a couple of decades for you to get comfortable in life. So I think a lot of people are just like, I want it now. And I'm like, you'll learn.
Yeah.
You'll see.
So what would you say a normal shift as a nurse would be like? I know you filled different positions, but like average day.
All right. So as a cart nurse, if you're coming in day shift, so you're coming in at 7 o'clock in the morning. You're getting report from the nurse that's leaving. You're making sure that your cart is clean. Infection prevention, gotta make sure your cart is clean. Make sure you have all the supplies that you need. Then you have to do a med pass for up to 30 people. So that means you have to give 30 people on average anywhere between 10 to 15 pills. You have to take their vital signs for 30 people. You only have 2 hours to do this. And then you have to chase them to make sure that they're going to breakfast, because breakfast happens at 8 o'clock and you don't get on the floor until 7:30, and then you have to make sure you're doing all of that. All while you're trying to make sure that all of your staff is working together happily as professionals, and making sure that the people are up. And if you have an emergency, you have to stop what you're doing and do the emergency. Then if the doctor comes in, you have to go and do the doctor's orders. Then after the doctor's orders, you have to make sure they're in the computer the correct way. Then you have to double check them. Then you have to call for labs, because sometimes they come in at 6 in the morning before you get there to get the labs. You have to see if there's anybody who has like a lab that's like really critical. Like, what if their hemoglobin, which is like their blood count, what if it's super low and they're like bleeding somewhere and you don't know? So like there's all these little things that you have to do in an 8-hour shift.
You're just getting pulled in every different direction.
Every single direction, and everybody thinks that you're the concierge, and everybody thinks that all of a sudden you have to bring them their drinks, and oh, I need some more tissues please, and I need to use the bathroom right now, and like you feel very overwhelmed. I have ADHD. It works wonderful for somebody who can multitask, and like I would get one of those like 4 little point Bic pens. We all know those pens. The black, blue, red, and green. You would take that and you would put all the important things in red that you need to do, and then you would put all the things that you need to follow up with in green, and then all the things that you're doing on, like notes for the day, and the different colors, and then you sign everything off in black because that's legal. And then you're just doing all the things that you have to do. And then you have to realize that it's not the same. Tomorrow's going to be a different day. There's going to be a different set of people. There's going to be different personalities that you get to work with. And then it just keeps changing. And if that's just for a nursing home. When you go to the hospital, you get people who just came from the operating room. You get people who are seriously, seriously ill, and you have to take care of them. I worked in the ER. Sometimes I worked where there was mom-baby units, where like pregnant women were coming in and they thought they were losing their baby. So there's like that placement. There were sexual assaults that I had to deal with. So there were so many different ways to be a nurse and feel like you're effective, but you only have a short shift to do it in. So sometimes it feels fulfilling if you take a step back and look at what you did for the 8 hours, but when you're in those 8 hours, you feel lost in the sauce. Completely lost in the sauce. I actually was thrown into the infection prevention role that I decided to pursue. A friend of mine was a DON, and she's like, I need help with an RN supervisor. I can do that. I've done that before. Walk in. You're going to pay me how much to just come in and just do this? No problem. And she's like, clean that office. I'm like, you're paying me to clean it? Okay. I go clean the office. And then she comes with a bunch of binders and she goes, fix this. I'm like, what? She's like, you're now my infection prevention nurse. You're going to fix this. And I did. I hyper-focused, ADHD. I hyper-focused. I color coordinated. I followed all the rules. There was a set plan of everything. It was beautiful. And then I ran with it and got certified. Started working with the Department of Health and the CDC, and I love it. But now I need a change. I want that one building that has that culture change to bring nursing back to where it needs to be. Because if you start with one building, it will be a chain reaction to others.
Your work with Project First Line, what exactly do you do?
So Project First Line is a CDC-funded project. They create education just specifically for healthcare workers. So anybody who works in healthcare that actually touches a patient. It's basic infection prevention. Washing your hands. Knowing what source control is. Knowing how to put on and take off your PPE. Your PPE is your personal protective equipment. So all the things that you would see the nurses during the pandemic wear. Those N95 respirators, the garbage bags instead of the gowns. You have to put them on a certain way and take them off a certain way. And if you don't do it, you're going to contaminate yourself. So I go in and I teach them these things. Cleaning and disinfection, because there's a difference. You can clean something, but you're not going to disinfect it. So there's a huge difference on how to do those things. And one, people are sick of the people that they work with already telling them the same thing over and over again. So I'll come in with a different view, a different perspective, a different language, and speak to them on their level, making it digestible. So once it's digestible and they're like, oh, all right, so I just wash with soap and water and then I bleach it and let the bleach sit for however many minutes, usually 3 minutes. For however many minutes, that means that the germs that are on there are gone. And then they retain it.
Yeah.
And then those best practices are shown when the patients aren't getting sick, when your family members aren't getting sick because you're not bringing it home to them. So those are the caveats that I do, is I use the escape room as a fun way of integrating and team building and teaching.
Oh, that's really cool, yeah.
It really is fun. I use different infographics that we have. If you've ever seen the poster with the T-Rex that says "didn't wash hands," that's our poster. Or the corgis that have the mask on the correct way, that's our poster. We're making it fun. People want to look at that. They don't want to look at the same thing over and over again. They're like, why is there a T-Rex in the bathroom? You know?
Yeah. Going back to talking about your average shift, do you feel like when you were in school they kind of hammered that into you? Not at all?
Not at all.
No? What did they say it would be like?
They didn't.
Okay, not at all.
They
Okay.
didn't. So nursing school gets you prepared for the nursing practice and recognizing what a normal body is and what an abnormal body is.
Okay.
They teach you about your health systems. They teach you about what it is that you're looking for somebody being sick. They're not teaching you the policies and the procedures in every different facility. And every facility has their own policy and procedure, and it has to be done that way, and you have to know that before you do anything. And then they have a stack of binders those are the policies and procedures. Nobody reads them. We know this. Nobody reads policies and procedures unless you're like me.
Yeah.
You have to read those things.
That's why you are where you are, though.
That's why I'm where I am. They don't prepare you, but they prepare you. Like, nursing school will get you ready to save a life, but maintaining everything and learning how to do everything and self-care, they don't teach you.
Okay, yeah.
But that's something that if you have a good leader in the building that you're going to or the facility that you're going to, they teach you how to do that. There's always that one old ratchety nurse that everybody hates. I always went straight to that nurse. And I was like, what kind of coffee you like? You want something for lunch? Because I'm going to learn from that nurse all the things that she's not sharing or he's not sharing with anybody else. When I did my clinicals at the Wilkes-Barre VA, Joe was the best preceptor. He's still there. I'm actually friends with his daughter. He is brilliant as a nurse. Would you notice that when he's walking by you? Nope. You wouldn't even notice that on the floor until you sat next to him and learned from him. Because he is that crotchety old man. But he's so fantastic and so sweet and so smart. And he's just an LPN. And there's never just an LPN. LPNs are superstars. I love them.
So we talked a little bit about what they taught you, but do you feel like you were adequately prepared based on the skills they taught you, like at least in the technical aspect?
So in the technical aspect, I was prepared in knowing where to go to find out something that I didn't know.
Okay.
I was prepared in knowing how to do certain procedures and things like that, basic procedures, inserting a Foley catheter. Drawing blood is never and will never be my forte. We have phlebotomists for that.
Right.
Love phlebotomists. But inserting an IV is different. And I could do that, okay. Again, everything is practice. So like I could never do a regular wing like everybody else when I started. But now I can do cat eyes and all different kinds of makeup. It's the same thing with nursing. You're not going to be good when you start, especially if you don't actively learn hands-on.
Yeah.
You're never going to be good.
How much practice do they give you in the program?
It's your clinicals.
Yeah.
And it's, honestly, they have a specific set amount of hours for each program for clinicals, but you have to make the most of it. You can hide if you want to and not do the things that you should be doing.
Yeah.
Or you can say, send me to the cath lab. Send me to do this. Can I do that? I want to put that rectal tube in. Like, you have to volunteer for that. There are people who, like, I did mom baby, hated it. Labor and delivery is not for me.
Okay.
And I avoided it to the last day And I'm sitting there and I'm typing on my chart because had a patient discharge in. I didn't have to watch her give birth. It was beautiful. And then my teacher walks by and she goes, Monica, come with me. And I'm like, no. She goes, no. It's time. And I'm like, no. She's like, come on. And I go and I stand there and she puts the gown on me and she says, here's the gloves, you're going to catch the baby. And I'm like, no. And I feel so bad because I'm Puerto Rican and it was a Mexican family. And so the daughter, the mother, the father of the baby, they're all there videoing. And I'm like, they're going to catch my face. I'm not going to have a face that's going to be digestible for the videos. It's going to be there forever now. And baby comes out and they go to hand it to me and I'm like, I know my face was bad. And the nurse caught it and she comes around and she goes, come on, let's go. I'm like, thank you. And she's like, why are you in here? I'm like, she made me. She's like, all right, can you hold a baby? He's like, I have two. Yes, I could do this. I just didn't want to see it. No. Nobody likes a specialty unless they like the specialty. That was never mine.
Yeah.
And they don't warn you what's coming out. Ever. And everyone's different. So for me, you don't learn until you put your foot in the door and go, all right, I want to do this.
So, as a last question, just as a closer, as a professional nurse, if you could give any sort of advice to the graduating nurses of this year and the future, what would that be?
Pick something that you love to do, because nursing is always changing. And be humble. Be humble. You're not going to know everything, because if you're not humble, you're going to kill someone. Be humble. Take constructive criticism. I am one of the most humble nurses. I'm a good nurse. I don't know everything. I'm not supposed to. Yeah, I'm supposed to ask questions, always. So be humble.
I am Andy, and this was Nursing in the Real World.